Welcome, everyone. Good morning. I'm so happy to see so many faces here today. If you are here for the Centering Language in the Pursuit of Health Equity, hosted by the Community Health Training Institute, you are in the right place. My name is Gina Rodriguez. I use the she, her pronouns, and I serve as the Senior Project Manager for the Community Health Training Institute, and we're the ones hosting this training. The Training Institute, or CHTI for short, we are a project housed within a larger public health organization called Health Resources in Action. Our office is located in Boston, Massachusetts, but we do work nationally all across the country. And we're very excited to see the registration for today's training because we have people joining us locally from Massachusetts, but also from all over the country. There were some folks that registered from Hawaii and California, New York, Pennsylvania, literally Puerto Rico, everywhere. So we hope that you're here and we're very excited to kick us off for today. All of our trainings that we offer through the Community Health Training Institute are brought to you absolutely free. And the way that we're able to do that is our project is funded by the Massachusetts Department of Public Health. And they are the ones that sort of prioritize this work. Our usual audience is coalitions across the state of Massachusetts, but in this wonderful online world that we're now living in, we get people from all over the place now, and we love it. We welcome it. It enriches the conversation. And in a second, you'll get a chance to hear from the trainers, and they're going to walk you through all different types of activities where you'll get a chance to not only engage with them and chat with them, and also engage with each other as well. I think we can go through the next slide. We're going to do a little bit of Zoom 101 for those of you that don't live on Zoom every single day, like I do. Probably a lot of you do, actually. But just to give you a quick lay of the land and how things are going to work today is that we are going to encourage engagement and involvement, conversation, and working together in this space. And the way that we're asking you to engage online is through some buttons on your screen. So if you're joining us via phone or computer, you should have access to most, if not all, of these buttons. The first being the mute button on the left-hand corner of your screen, where you mute and unmute yourself to join the conversation. You probably have noticed if you came in with your mute button off, so like we could hear your background noise, we probably muted you. Please do not be offended and don't take it personally. We just want to minimize the background noise so that when we're delivering content, you're able to hear everything. But of course, if you have a question or you have a comment or something that you want to share, please hit that mute button, unmute yourself, and join the conversation. The same with the video button. We always appreciate when we can see someone's face, see your reactions to the content, the questions, see if you're laughing at our corny jokes, all that kind of fun stuff. But if for any reason you need to turn your camera off, walk away from your computer, take care of something that you've got going on in your background, you're more than welcome to do that as well. I think we'll go over agreements at some point, but we welcome all the stuff that's happening in the background if you don't want to turn your camera off. I love seeing pets and children and spouses and roommates, all the kind of fun stuff that happens back there. Some other buttons that you'll get a chance to interact with in this training as well is your chat button. I see a lot of you already saying good morning, saying hello, introducing yourselves. All of that is really wonderful. You're welcome to add questions to the chat box, share resources. They'll probably come up throughout this training as well. The trainers will also add links in the chat box as well for you to engage with. You can also do reactions on your screen. So if you wanted to clap at what someone was saying or share some love and do a little heart emoji, you can do that as well. And also on the right-hand corner towards the top of your screen, you can change how you view your screen. You can watch gallery view, side-by-side view, speaker view, however it is you want to orient your screen to engage today. There are some other functionalities that are highlighted here that we probably won't be using today. So I think that'll be it for the Zoom 101 content. And yes, just want to welcome you again. We're so excited to have you here. Our training team today will be Jasper, Tanayo, and Gracie. And they're going to introduce themselves in a second, but just wanted to say hello. Let us know if you have any questions. And I think I'm handing it over to Jasper.
Yes, thanks so much, Gina. I'll introduce myself, then toss it to Tanayo and Gracie before we get started. My name is Jasper. I use they, them pronouns, and I'm a program associate here at Health Resources in Action. And I'm just excited to be with you all today. I know we were watching our registration numbers creep up this morning, so just asking for some patience since there's 114 of us in this virtual space, and we'll try to make it as interactive as possible. So I will pass it to you, Tanayo.
Thanks, Jasper. Good morning, everybody. My name is Tanayo Crow. I use she, her pronouns. I am a program associate with the Community Health Training Institute. Very excited to be here today. I've been with HRIA for about 3.5 years and on the Community Health Training Institute for all of that time. So really enjoyed this project and really enjoy these training spaces, and so happy to have you all here with us today. And I will pass it to Gracie to introduce herself.
Thanks so much, Tanayo. Good morning, folks. It's really nice to be with you all. My name's Gracie Rolfe. I use she, her pronouns. I'm a manager within the Training and Capacity Building Department at Health Resources in Action. So do a lot of training, facilitation, and really excited to be with you all today to do this language training. I think language is really important no matter what kind of facet or sector of public health we find ourselves in. And as we'll kind of explore together, language is not something that we're trying to, make like politically correct or because like we're super sensitive, but because like language has real world impacts and real world implications. And I hope that we'll be able to sort of explore and unpack those together today and hopefully, gain some ideas and some frameworks. I know that Tanayo, Jasper, and myself are by no means experts. We just have some ideas and looking forward to really engaging with you all and hearing about the work that you're doing and how you're seeing these kind of themes and topics come up. So I'll kick it back to Jasper, but really excited to be here.
Thanks so much, Gracie. I think we can jump through the next couple slides because I think they're all still kind of about Zoom, but we'll be using some breakout rooms today to make sure that you aren't constantly in this main room of 117 people. So just be ready to start sharing at different points across this training in groups of about 3 or 4. And the Zoom controls should be mostly pretty much the same with the Zoom, like mute and whatnot. So, and if you're having some trouble with audio, you can always join via your phone audio. So if you just go to the little caret next to your mute button, there should be an option that allows you to switch to phone audio. And then you can call in and then listen to this training over your phone. And so if you have any questions about that, feel free to put it in the chat box. But without further ado, I will take us to our content for today. So our training objectives are really trifold. We want you all to really feel empowered to have this deeper understanding of what inclusive language looks like and how to use it. We also want to give you some frameworks to really help you interrogate that language so you kind of have a shared understanding and some theory. And lastly, we want you to be able to really apply these lessons, right? So we can do all of the learning in the world, but if you're not applying it, then, why did you come? So this is really to help equip you to be able to make these safer and more comfortable workspaces for, your fellow employees, yourself, clients, whoever you're working with. Go to the next slide. And then this is our agenda for the day. So right now we're still in our little welcome introductions phase. Then we're going to move into just a really brief and quick history of public health language and how that's changed and what that looks like. We're going to talk about how to respond to harmful language in the moment, and then just more broadly how to confront that bias and bigotry, as well as kind of give you some opportunities to create a work plan and really think through some of those strategies to bring that back with you once you leave this training space. Really with the intention to be able to give you all the tools to be able to both have those proactive strategies of like, how are you going to make these changes within your own organizations to have this more inclusive language, as well as some of those more responsive strategies so that this way, if something comes up in the moment, you feel ready to respond, right? So really trying to speak to, I think, both ends of that spectrum. So without further ado, here's some group agreements. If possible, we'd really love it for you all to have your cameras on. It gives us the chance to see your wonderful and beautiful faces and kind of have that gauge of how we're doing to see if folks are checked out or if you're really invested. If you could please mute yourself while you're not speaking. We've got a very large group of folks here today, and we just want to make sure that the audio comes through nice and clean. And lastly, challenging yourselves to both take space and make space. So if you're someone who tends to bring your voice into the space a lot, maybe giving folks who are a little bit more internal processors or a bit more introverted the space to bring their voice in as well. Obviously, respect is key, but we also want you to make sure that you have what you need to take care of yourself too, right? So we're going to be going through content that, you know, talks about how are we going to problem solve when, you know, harmful or hurtful things are said. So we want you to pace yourselves, you know, bring yourselves into the space, you know, the good, the bad, and the ugly. And lastly, you know, be okay with discomfort. I think discomfort is different from being unsafe, and discomfort can really be the room for a lot of growth. And so these are the group agreements we really want to put on the table for you today, that we can kind of share and, you know, hold together, keep ourselves accountable to making sure that this space is a learning space. So if these sound good to you, or if you have any questions or things you want to add to the list, please feel free to dump that in the chat box, give us some reactions so we know that folks are on the same page. Start to see a couple Zoom thumbs coming in. Okay, looks like we've got some good consensus. All right, so we'd like for you all to, you know, introduce yourselves. I know the chat box has been kind of going off and it's been great to see folks' names and where you're from. But if you haven't yet already, we'd really love to hear from you in the chat. And just your name, pronouns if you'd like, the organization you're coming from, and then just give us a temp check. How are you feeling today? 1 through 5. You know, 1 being like, I dragged myself to be here. And 5 being, you know, I'm feeling exactly how Jasper is today, like super enthused, ready to jump in, high energy. Okay, see Damien's a 4, Dora's a 4. We got a lot of 4s coming in through the chat box, got some 3s. And also if you'd like to answer our icebreaker question, you know, what movie or show do you think is underrated and doesn't get enough love? I know folks have really strong opinions about their TV, as do I. So we got a lot of folks. We have Bedford, Old Colony YMCA, trying to keep up with Milwaukee. I have a really great friend in Milwaukee. And Tanayo, Gracie, I know I've also been doing a lot of talking. How are you all feeling? Anything you would like to add at this point?
I don't know. I'm feeling like a good 4.5 this morning. A little bit tired still, but always energized to be in these training spaces with you all. And of course, I saw this icebreaker question and immediately forgot every show I've ever seen in my entire life. So very excited to see what you all put in the chat.
Yeah, I feel like a 4. Like, I think I'll get to a 5 very soon. Thanks to you all. Yeah, and I'm still thinking about the movie or the show. I'm like put on the spot, and everything in my brain has left my brain. So, but love what everyone's putting in the chat.
See a lot of folks echoing Ozark. I know I'm a big fan of Ozark. I'm just finished the most recent episodes that came out. So I'm eagerly awaiting the next installment. But okay, I think just in the interest of time, let's move into our first activity. So you all are going to be sent into some breakouts, and to really center ourselves in this space and really start thinking about the content and just the reality of where we're coming from, different organizations and, you know, different sectors. We'd really like you all to think about your work in public health. And then think about some of those topics that you either work on or read about, have heard about, such as maybe abortion, substance use, homelessness, etc. And think about a time when some stigmatizing language was used and a time when inclusive language was used, right? And really kind of get at that nugget of why is it important to be critical about language in, our public health world. And so we can put also, I think, those instructions in the chat, since I know you all might not necessarily have the slides with you. So I'll put that in the chat box for folks. But we'll be putting you into small groups for about 7 to 10 minutes, and be prepared to report back whatever you all feel comfortable sharing back. just so that this way we really have a starting point to use some of those scenarios and ideas to problem solve later and really think about the situations we're in and how we can respond. Any questions about what we're doing? This feels good. Maybe give me like a wow react, a heart react, a thumbs up. I always love the wow react. I think it's a lot of fun. So I see I have one person who wow reacted, and I see you. Okay, great. So it looks like we're on the same page. Gracie, Tanayo, whichever one of you is making the breakout rooms, I think we are all set to start kicking folks off. And let us know as well if you're having any issues getting into your breakout spaces for today. Okay, so let's kick things off a bit. So if we can go to the next slide, we're just going to debrief and share out some of the main topics or themes that you all shared. So anybody, want to kick us off? What did you talk about in your breakout spaces? What kind of came out? Feel free to come off mute or put it in the chat box. And if we can maybe exit just this slide share mode, so this way we can see the notes that we're typing, Gracie.
I'll go first. Our group talked about the importance of language in empowering the people that we're working with. So making them, so an example that Whitman's gave was calling people who have experienced sexual assault, calling them survivors as opposed to victims, calling people experiencing homelessness just that as opposed to defining them as homeless, and then talking about the use of nicotine as actually an addiction, and pointing out that there's a whole industry like directed at sort of at making you become addicted to it. So it's not, that people should feel empowered that they can sort of fight back against that.
Thank you, Christina. I think that was you who was speaking. I think that's really crucial. And I really see that. I think that's also coming through a bit in the chat box. I see Ashley saying, not letting language determine who someone is, right? And kind of using some of that person first language, which we'll talk about in a little bit more, right? As a person who lives with diabetes, not someone who's, not just like a diabetic, right? And kind of using that to center like the humanity of folks, right? I see in the chat box also the importance of pronouns. Language can alienate or include people. Scrolling through, y'all have so many great things in the chat box. Can
I also say, Jasper,
yes,
that one of the things that we took away, which I thought was really great, was we were talking a lot about grants and how the writing in grants obviously does indeed impact, public health. And you'll see lots of terminology that's really old still, like minority. I'm not minor, I'm not lesser than, and it's still used a lot in language. You'll also see a lot of, kind of cross, basically grouping of different groups of people. So for example, people use the BIPOC term, and I think Ashley just wrote that, and it lumps, people into one group. But the same thing with the LGBTQ plus IA plus, they'll kind of have grants that fight each other. So it's like, we only have enough money for one. So if you're one of these subgroups, you can apply to it. So I think that's, another thing that I noticed as well.
Mm-hmm.
And we talked about.
No, I really appreciate that. I think you're definitely right. And I think that's something that we're going to touch on also right later as we kind of move more into this content of, where does language both, where do we draw the line? Like, where's that gray area around how inclusive can we be? And at what point do we start like conglomerizing, right? And lumping folks together, and, it gets really messy. It gets really complicated. Go ahead, Desiree, I see your hand up.
Thanks. Yeah, so a lot of the things that were mentioned were already shared by a lot of folks here. But there's also talk about internal communications and making sure that staff, everyone feels included. And an example was given around language barriers, quote unquote. And there being this idea that like, well, oh my gosh, I'm so sorry, Gretchen, I'm going to completely mess this up, but the microaggressions that can take place when people are being saying like, you need to speak English, or you need to say it this way or that way. And that they're being the intent really being so that everyone communicate more openly and freely, and that the conversation can be enriched with all the different languages that are in the workplace. One other thing that came to mind as we were talking about empowerment was reminding me about how I've been working after hearing Natalie Burke talk about the use of empowerment in the context of community health work, that we're not empowering people, we are assisting in harnessing their power. They already are inherently powerful, just like all of us, and that empowering people really isn't, I've really been trying to steer away from that, because I'm like, no, you're already powerful, harness the power. And we're assisting with that process. And so that just came to mind too. But also in the context of substance use prevention, really quick, we were talking about how that language changes constantly because we're always trying to understand better how to center people, especially with substance use disorders. So yeah, so thanks everybody. And that was just a small amount of stuff.
Thanks so much, Desiree. Let's do Alexis and then Adania, and I think then we'll keep this conversation moving, and we'll make sure that try to get as many voices in the space and transition to our next piece. Go ahead.
Hi, yeah, so the thing I was actually gonna say is very related to something that Kim just put in the chat, which is around blaming. I think one of the things we talked about is just with using stigmatizing language, there's often like blame and shame that's kind of like rooted in that language. And because of that, it sometimes influences the approach that we take to addressing certain issues or supporting communities. And so, you know, sometimes inclusive language will kind of like remove blame and shame. And I think it just even changes the direction of the conversation and how we're talking about approaching certain issues.
Thanks so much, Alexis. I think that's really crucial. Sorry, go ahead.
Don't worry. I was talking that because I live in Puerto Rico, our language is very feminine and masculine. And sometimes there are no words with the neutral significance. And that was a challenge. And also because in our culture, we are so used to say those stigmatizing words. It's very difficult for you to like understand what you're saying, or to be sure that you're changing the way you're talking in a way that you're not offending, or you're not saying something that could affect other people. So that's a very something very difficult in the Spanish language.
Yeah, I appreciate that. Thank you for bringing that into the space. I think, I mean, one overall theme, and I think kind of the reason why a lot of us are here, right, is that language is inherently limiting, right? There's never going to be a perfect way to say anything, right? And so how are we, you know, moving to improve and say the things as best as possible as we can? That's always a moving target. So let's do Chen-Chi, and then we'll keep on moving in our content. Go ahead.
So in our group, we talk about how sometimes when we lump a whole population together in a group, we tend to attach certain stereotype to it. So for example, Asian often are not considered as people of color. And when we talk about Asian, we thought that they're all supposed to be healthy, wealthy, and well-educated. And that kind of feed into the model minority myth and reinforce the stereotype and pit Asians against the other populations.
Yeah, thank you for sharing that, Chen-Chi. I definitely, I agree wholeheartedly. I want to validate that. And I'm hoping that sort of as we move into this next piece, which is the history of public health language, we're going to kind of start, I think, breaking apart and introducing some of those frameworks that hopefully can help us talk about, right, all of the different nuances around inclusion, exclusion, and things like that. So Gracie, if we can move along in the slides, please. And keep also all of these thoughts coming through in the chat box. I know as I'm speaking and facilitating, I'm only able to like grab little snippets, but everything I've been reading has been like hitting the nose on the head, just in terms of like the different things that we're grappling with, right? Like the real life problems and things we're trying to tackle. So just moving into a really fast, right, the history of public health language and the history of public health. There could be a whole like 7-hour training on this. So this is just the really fast, you know, overarching snapshot I want to give you all, right? So historically, when we think about the history of public health in the US in particular, we really started, right, with this top-down approach led by people in power, right? Especially government and academia, right? We had all of these like really old hospitals pop up and develop over time. Just thinking about, right, Mass General, which is in, you know, HRA's own backyard in Boston, right? And it really started from this kind of downstream approach of we're just gonna treat the symptoms of illness, right? And what illness is and what it's defined as, right, is very subjective and changes over time, and was really, really rooted in just this small, tiny, tiny piece of access that folks with privilege were able to have, right, when it came to what we formally recognized as public health or medicine. Kind of fast forward now into several decades of change, right? Just thinking about kind of from the early to mid 1900s and onwards, right? We had this huge boom in community movements, right? That really always had been there, right? Communities have always been fighting for change and inclusion and power. And we really see, right, this tipping point, especially kind of in the mid 1900s with a lot more community voice, the civil rights movement, et cetera, right? With a lot more of this focus bottom up, right? About what are these, as we call them, right? Social determinants of health, but looking at health in a lot broader of a way, right? And so we're not just looking at, you know, it's not just the medicine or the hospital you go to, though that in and of itself is an equity concern, right? It's also the food you eat and where do you live and your access to transportation and all of these other things. And we start to really see this pressure to share power and really right these historical wrongs and look at public health in a really broad way, right? So we're not just looking at kind of these downstream, you know, occurrences of what happens, but we're also looking upstream. And so you see a lot of that really starting to shift, and the language starts to change as well, because once you start having, right, more folks included and in the room, you start to have a lot more voices saying, don't call me that, don't refer to me this way, right? Use this instead. This is what I prefer, this is what's empowering, and then this is what, you know, is true, this is my reality. And so we really see a lot more of these impacts today, where it's a lot more interdisciplinary, and, you know, it's constantly changing, right? And I think that really comes through just even in who we have in the room, right? We have folks who are coming from a clinical background. We have folks who work at community health centers in this space. We have community organizations, right? There's a whole breadth of folks. And we all are here because we somehow see ourselves as plugging into, right, public health and health equity. And what does that look like? So I'm going to pause there before we keep on moving, just for a temp check. Does this make sense? Is this resonating? How are folks feeling? Just give me some reactions. See them coming through. All right, looks like we're all following. All right, if we can go to the next slide, please, Gracie. And I just wanted to help give y'all some frameworks. I think some of these shouldn't look new, but I'm going to throw it to you all. So right now I have just listed a very short list of all of the, like, you know, probably hundreds that exist out there, but these are, I think, some of the main ones that really come through. So we have critical race theory, intersectionality, queer theory, disability theory, and class analysis. Would anyone like to take a stab if you feel like you know what critical race theory is, just defining that for us. So feel free to come off of mute, put it in the chat box. I've been doing a lot of talking, so I want to hear from you all. If you use these in your work, how do you define them? How do you explain it? So anyone want to take a stab at kind of explaining to the room what critical race theory is?
So this is Brandy. So critical race theory is something that is actually taught in law school rather than in middle school, elementary school, high school. And it's really looking at how our system as a whole within the United States, all these different systems have been built to make lives, white lives, usually white male lives, but white lives easier, make lives more beneficial, and how people of color, specifically generally Black, as well as Hispanic people and Indigenous people, how they are not taken into consideration or actively, the system actively works against them.
Yeah, love that. Thank you, Brandy. I think really highlighting, right, that systemic portion, right? This isn't, an accident. It's all very intentional, right? The way that things are set up and the way that, white supremacy functions. So thank you. Anyone want to take a stab at intersectionality, right? Which really comes from Kimberly Crenshaw.
Yeah, this is Claudia. Intersectionality is kind of a framework to analyze, people's oppression and privileges through the lens of how different systems interact to create a specific social identity, rather than put the privilege or oppression on the identity itself. So, for instance, like a Hispanic, a Hispanic queer woman. The systems that impact me are, racism, sexism, and, homophobia. And that creates my identity. It's not that, the identity is not something that you can touch or grasp or that is inherent to the world. It's created by these systems and how these systems make a specific identity.
Yeah, thank you, Claudia. I see some clap reactions coming through. Yeah, I think once again, you hit the nail on the head, right? You can't filter out just one identity, right? One aspect of yourself. You're always bringing your full self into a space. And what that looks like is really shaped by all of these forces that be, all of these systems of oppression and privilege. I also want to highlight some things we have coming through in the chat box from Ashley. Yeah, the concept of race itself has been created through colonialism, white Europeans, and, was invented to create these systems of power. That could also be a whole other training. And also highlighting what Stacy said, which is true. It's really civil rights scholars and activists who came together and really said and pushed forward, right, these frameworks of critical race theory, intersectionality, et cetera, right? So these frameworks themselves come from communities, the communities themselves, and that what makes them really, really, powerful, and why I wanted to include them. So as we keep moving forward, anybody want to take a stab at queer theory?
This is Autumn. I would say for me, the big thing that queer theory does is sort of observe and criticize the structures like the nuclear family, like the idea of a single man-woman couple, and start to kind of problematize them and criticize them and sort of provide alternatives to. And I think to sort of connect it to the idea of critical race theory, it's really looking at how, these structures that have been put in place are kind of taught to us as if they're natural and as if it's just the way the world works. And I think what queer theory does is say, no, that's not true. Let's look at what else is going on.
Yeah, you all can teach this trait. I don't know why you're here. You definitely don't need CHTI. But yeah, once they, you killed it, Autumn. And that's also to say too, I want to kind of tease apart that last piece that you said, right? None of these frameworks are mutually exclusive, right? They talk to each other, they interact, they support and critique each other, and they all build upon each other, right? So not just, it's not kind of a pick one and leave the rest, right? They're all really, really intersecting. Anybody want to take a stab at disability theory?
I mean, I don't want to talk too much, so I'm trying to give space. But what I will say is terminology has been put in place to minimize and kind of set people apart. So a lot of times you'll see, instead of the term disability, you'll see abled. So people are abled or differently abled. In the education world, which is part of my world as well, you'll see, students that function or learn differently being called neurodiverse as opposed to disabled or things of that nature. So I think it's just, again, sometimes a label that, has, I guess, changed from what was called handicapped before to disabled, and then is still kind of progressing into something potentially different.
Thank you for uplifting that, Stacy. I think that's a really, really important, crucial piece, right? Is even the language of what these frameworks are called. And what, it's always, always, always a moving target, right? Yeah, how do we make our spaces accessible, and what does that really look like, right? And it changes per field, right? You said you were in education. That's, a whole system, a whole realm of like how that manifests is going to look super different than if we move into maybe like a clinical space, for example, right? Okay, I know I'm also keeping an eye on the time because we can spend forever just even unpacking this slide. But our last one that I listed out here is class analysis. If anybody wants to bring your voice into the space and kind of explain what is that. And I know you all have thoughts because I see the chat box going off, and I know so I know folks are talking about it. Does money impact our health? Does it not?
I'll speak. Well, it takes me back to this whole concept about how your zip code is a good way to predict your life expectancy, and how, like there are things like income, the concept of class itself, who has access to resources, who doesn't, who is seen as deserving of help and who's seen as not deserving of help. So who can afford care and who can't, who can afford food and all these other things.
Yeah, thank you, Damien. I feel like you really captured that nugget, right? How are we gatekeeping resources? How does that come through in the language that we use, right? When we talk about people as deserving or undeserving of care, things like that. What are we saying that really kind of gives away, right? That internalized concept of like, what are you actually thinking when you're thinking about, who has access to what, right? And so I think the big takeaway that I want you all to kind of walk away with from this slide, in addition to maybe like learning about maybe a new framework or two if you hadn't heard of it, is really, right, these frameworks come with the inclusion of more appropriate language that comes from the people in those communities themselves, right? It's folks taking a stand and saying, no, this is what I'm saying, this is how I want you to call me, and this is how we're going to talk about this, right? This is the framework, this is the lens that we're going to apply to this problem and kind of move from there. If we can go to the next slide, Gracie. Just to give you an example of like, what does this look like, right? at CHTI in our work, we really try to center person first and gender neutral language, right? This slide comes from kind of one of the substance use trainings that another like program at HRIA has. But really looking at how we say things has a really big impact, right? So talking about folks living in recovery and, you know, making sure that we're not talking about things through this moral lens, right? Of, you know, it's bad to be doing this, when in reality, you know, it's a disease, right? And so we're making sure that we're elevating the humanity and the people, and making sure that we're really centering, you know, the humanity of it all. I'm also going to pause here since I've been doing a lot of talking. If any of my co-facilitators want to jump in, I know Gracie, this was also, this slide was, I think, a little bit your brainchild as well.
Yeah, thanks, Jasper. I think, you know, something I'll add, and I think you'll see this theme kind of come up, and we've definitely alluded to it already, but like, we're not trying to put this language out here as a ploy to be like politically correct or because we think it sounds nice, but because it really does have real world impacts. There's handfuls of studies that show, especially like in the addiction and substance use world, when providers, clinicians, nurses, doctors, therapists, social workers who are working with people who are using drugs, when they use kind of the say this person-centered language, those people are retained in treatment longer, they are engaged in treatment longer, and they ultimately have better health outcomes, right? So if that's the like, if someone is going to stay in treatment versus someone leaving treatment and possibly like overdosing and dying, it should not be a hard ask for me to change my language, right? Like if it comes down to that, it should not take a lot for me to change my language. And I also want to honor and acknowledge it can take years for us to really shift our language. Like the Bureau of Substance Addiction Services, which is housed within the Massachusetts Department of Public Health, up until like 3 or 4 years ago, they were called the Bureau of Substance Abuse Services, right? And that was like, that has a negative kind of connotation. So even that shift happened in like 2018, 2017, 2018. So just recently. So I just want to acknowledge that, like, you know, language can take time. But Malika, I did see that you had a hand up, so I'll pause there.
No, I was just saying, one of the things that we talked about in our group, and the slide is excellent. We talked about the interface with other systems. Yes, we may be making changes in public health, but when you're talking about drug offender and they're interfacing with the court, again, we have those same challenges because in some of those systems, that language hasn't changed.
Yeah, I love that. Thank you for bringing that up, right? We can do all the work that we can, right, in our own lives, in our workplaces. And that's still only a tiny, tiny fragment of, right, all of these larger systems that be and how they interact with others. And so it is a challenge, right? Just naming that. This is not easy work. You would think that, you know, just reframing a single sentence and making that change, it's simple on the surface, but there's really, really deep structures that exist that intentionally also, right, keep our language the way that it is, right? There's a reason why it's really difficult to push back and change a lot of this language to be more inclusive, right? And that's not an accident, that's not intentional. So if we can go to the next slide, just to keep things moving. Just another, like, this is a quick example that I pulled from the World Health Organization's website around quote unquote maternal health, right? And I sort of bolded here some of the key words that they were using and talking about quote unquote maternal health, right? On their website. And so if I can get a volunteer just to read this, these couple sentences out loud. Anyone want to bring their voice into this space?
I volunteer myself as tribute.
Yeah, go for it.
So maternal health refers to the health of women during pregnancy, childbirth, and the postnatal period. Each stage should be a positive experience, ensuring women and their babies reach their full potential for health and well-being. Every pregnancy and birth is unique. Addressing inequalities that affect health outcomes, especially sexual and reproductive health, and rights and gender is fundamental to ensuring all women have access to respectful and high-quality maternity care.
Thanks, Rob. All right, so I'm just going to be quiet and kind of let that paragraph sit with you all for a moment. I know for me, when I was developing this slide and, working on this aspect of the training, this was like the first thing I thought of is like, what's a great example? As someone who's trans and non-binary, but who was assigned female at birth, right? Whenever I think about quote unquote maternal health, I'm like, damn, like this is about my health, but like, I'm not a woman. Right. And so when I think about how we can change and think about and work around some of this language to be more inclusive, like this to me was like the first thing that came to my mind. So if anyone wants to come off mute or just drop in the chat box, how would you change some of this language? Right. How would you change some of the language that I highlighted in red here to be more inclusive? What kind of phrases, terminology, vocabulary would you use and say? Kind of replace what the WHO is saying here. And I'll even take a step back too before, go ahead, Alba, but I'll also take a step back too. Why does it matter? Why does it matter that we're changing the text in red? So go ahead.
To answer your last question, because we want to be inclusive of everyone. And then I would change it to the health of people, or the health of a person. Just to be more inclusive, ensuring people, and then ensuring all people have access.
Yeah, thanks, Alba. I also see in the chat box coming off, switch women to birthing person, health of parents instead, right? And also, the irony, pregnant people. Yeah, and also just the irony too, I found, of the WHO being like, inequalities affect health outcomes, and then proceeding to also use this language, right? So, it's a moving target. Our intentions can be in the right place, but, there's a lot of different ways to say things, right? And I think that's coming through too, right? We can say birthing person, parents, pregnant people, right? There's a lot of ways to say this. And also just to quickly address too, Nina, I saw your question come through in the chat box. Since this is from the WHO and their audience is international, does that affect the lens we see? I think that's a good critical question, and it's not one that I'm gonna, pretend to know the answer to, right? Because once again, we're holding this training in English, which has, gender neutral pronouns, and there's a lot of different ways that we can, frame things, talk about things, and it gets messy when we start getting global and a lot of languages are in the room. I see from Rachel, people with uteruses, ovaries, feminine reproductive organs. And we can go to the next slide, Gracie. This is just what I said. This is what I used, right? Me, singular, one person. This is the language I used, right? So natal health, people with uteruses, changing things right to people or parents, natal care, right? There's a lot of different ways we can say things to be more inclusive. And this is just one of them, right? There's a lot of different ways, and like I said in the beginning, language is not perfect. There's no perfect way to say things, right? It depends on the context that we're talking about things. Any other thoughts before I move to the next section and then kind of wrap this section up and hand it to another one of my co-facilitators? In the chat, reproductive health could include healthcare outside of the context, yes, of just, pregnancy and birth. Yes, definitely, Jenna.
Yeah, this is Nina, Lindsay. I think one question too is, does this also exclude people who may be adopted? So do those folks have, they're going through a child rearing process. So is it just about the actual kind of birth process, or people who adopted, they have health needs as well during this period?
Mm-hmm. I love that. I think that's really crucial. Thank you, Nina. We also have in the chat, Margaret, it's hard to know because, you have to use vocabulary that people know, right? We can't get super jargony. We have to keep our language accessible. And that's half the problem, right? When we, maybe come from, academic backgrounds or whatever, and we start using these really big buzzwords, you can say, right, as jargony of a sentence as you will, but if no one understands you, then what's the point, right?
I will say that thinking about some women in population that I might have a conversation with, they would definitely understand the term maternal health more than they would understand natal health. They would ask me to explain what that means.
Mm-hmm. Yeah, thank you for uplifting that, Paula. I think that's a really great, it's a great example of how I feel like, how are we going to take this language and move with it beyond this training, right? And that's one of those kind of scenarios that I'm hoping you all will kind of keep in the back of your mind, maybe that you're working with, right? Of this term, this language is already really well established and people know what I'm saying when I say this, but what's the impact of me keeping the language the same versus changing it, right? And I'm not adding a value statement or value judgment there, right? Just neutral, but what does it mean, right? What are the impacts when we start thinking about the actual process of changing it? Thank you. If we can go to the next slide, please. Then I'll hand it off to one of my co-facilitators, but this is just something that I wanted to highlight, and it was something that I know we talked about as trainers a lot, right? As Gracie said before, right? This is not about being politically correct, in kind of the way that I think, a lot of this language is politicized and used when really, public health is about equity and the personal is political and all of these other things, right? But just looking at the straight up facts that we know, right? Like gender neutral language has been proven, right, to increase positive societal attitudes towards queer people and gender minorities. I also see in the chat box, we're talking about bioessentialism and yeah, all sorts of stuff. All right, I'll let the chat keep going as we keep moving forward. But yeah, and using the correct language and name for trans folks reduces suicidal behavior by more than half, right? That's insane, right? Just thinking about what Grace said earlier, right? This reduction in stigma, it saves lives. And so, really thinking about, if we're talking about concrete real world impacts, there are these measurable health outcomes, right? There are actual physical changes that we can see being made. And so that's really, the impact of language, right? It's not just about, us being sensitive, et cetera, right? All of this coded language, it's about the health and lives of people. So I will pause there. Before I transition and hand it off to Tanayo, if there are any other questions or comments about just the content that we've covered so far. I will pass it off to you then, Tanayo. And thank you for your patience. I know things are also really difficult when we have like over 100 people in the room. And yes, the slides will be shared afterwards, Jenna.
Awesome. Thank you so much, Jasper. And thank you all. I just want to say already this discussion has been so fruitful and so nuanced and so interesting. And we just really appreciate the knowledge that you all are bringing to this space. We mentioned at the top, but we're definitely not experts, right? We are here to offer you this information, these strategies, etc. But we are just as excited to learn from you as hopefully you are to learn from us. So we're going to be transitioning just a little bit in this next section and thinking a little bit about strategies. And these are going to be primarily sort of reactive strategies, so things you can think about in the moment if you hear harmful or stigmatizing language. Just want to say, this is not going to be an exhaustive list by any means. We are always open to pushback, to additions, to comments and questions. So take that with a grain of salt. These are things that we think can be really helpful, but of course, situationally, these might not all work for you. So please take what does work and feel free to leave what doesn't. And again, we want to hear your strategies as well if you have things that we don't cover. So just to say, if you're looking at this photo going like, why did she pick this picture? It was because when I was looking for a visual, I was thinking about, okay, like, what's a time when I felt like I really just missed my chance, right? And I found this image of this person like head down on the desk, you know, and in my head, they're thinking like, ah, shoot, like I really just messed that up. Or I really missed my opportunity to say something, right? And I know I've been there, personally speaking. I'll try and use I statements, but I'm sure other folks have also been there, right? Maybe you hear something, someone said in passing, you see something on TV, and you're like, wow, I really wish I could have responded to that, right? I wish I could have interrupted that situation. So if we move to the next slide, please. I'm gonna walk us through these strategies. We'll do this relatively quickly, but I really want to engage you in this process. And again, just hear from you if you want to unmute or throw it in the chat box at any point. I want to hear how these strategies are landing and of course, any additions or pushback. So I'm actually going to ask if someone could please read for us the first box that says interrupt early. Someone would be a brave and lovely soul and come off of mute.
I will interrupt early and be firm, objective, and no nonsense.
Thank you, Deline. Did I say that correctly?
Yes, you did, Deline.
Awesome, thank you. And can someone read the next one for us as well? Be direct.
I can read it. Be direct and specific about what was harmful, stigmatizing, and why.
Thank you. All right, and number 3, please. One more person.
I'll do that. Keep conversation focused on the problem.
Thank you. Thank you, 3, for reading those first ones. So I'm pausing us here because in my head, these first 3 are pretty tangible, right? These are all things that when we hear them, when we see them, we're like, yes, that makes sense. So interrupt early, being firm and objective. So stigmatizing behavior and harmful language can really persist if we don't address it right there in the moment. So getting there early, like saying something right away, that's really important. Definitely don't laugh at anything harmful, right? I know sometimes, again, I statements, I laugh when I'm uncomfortable, right? That's not a great response if something really hurtful has been said. So just think about that, right? Think about how you might respond if you hear something that makes you feel uncomfortable or is causing discomfort in the space that you're in. And don't be afraid to use silence, right? I know we as facilitators like to use silence. I will sit here for minutes at a time if I'm waiting for someone else to speak, right? I'm totally fine with that. And silence can be really powerful. I had a teacher in high school, my English teacher, who would just get fed up. He would just get fed up with us. So he would sit on his desk and he would cross his legs and sort of like tense his hands and he would stare at us quietly. And within, I don't know, 60 seconds to a minute, 2 minutes, people would stop talking, right? All my classmates would look up and go, Mr. Lahiri, he's just staring at us, what's happening, right? So silence can be really effective. Sometimes you have to let people sort of hear themselves too, right? And give them that moment. Number 2, being direct and specific. Again, pretty straightforward. So it's really helpful to say things like get to the point, right? Be specific about what you're interrupting and why. So I can throw out a personal example. My name is Tanayo. I have spent my whole life dealing with horrible jokes about how my name sounds like tomato and all these other things that are just like really not great to say to people, right? So if someone said that to me, someone made a joke about my name, I might say something like, you know, it made me really uncomfortable when you made a joke about my name. I've heard that joke before and it makes me feel disrespected, right? That's getting to the point, that's direct, that's specific. And then the third one, keeping the conversation focused on the problem. I think it can be really easy to want to fall into the pattern of like listing out every horrible thing someone has ever said, right? If you're like, wow, you said this thing, and also last week you said this other thing, and that was really awful. Like that might be a conversation you have to have, but in the moment, right? We're thinking about reactive strategies. In that moment, when something is harmful, when something is stigmatizing, stay focused on that one thing, right? If it merits a longer conversation, then so be it, right? You can pull that person aside later. But for the moment, for interrupting that harm, just stay focused on what the specific problem is. I'm going to pause. I want to hear from you all. Have you used any of these first 3 strategies before? Have these come up in your work? I want to hear from you. Feel free to unmute or throw it in the chat box. Yeah, thank you, Nina, or Nina. I hope I'm saying that right, Nina. Being direct is triggering to people who aren't used to that style of communication. Absolutely, absolutely. So I think one piece of this is knowing your audience, right? So, and yeah, Ashley, great point. We can use call-in culture. So I definitely think you can be direct and not cause further harm, right? So especially things like using I statements, not saying like, you know, you, Gina, you said something really horrible and that was so mean. Saying things like, I felt really, you know, affected by this because can sort of hopefully help you not cause further harm in that situation. But I'll stop talking. I saw Alexis, your hand go up. Go for it.
Yeah, thanks, Tanayo. I think to the point that, was it Nina was making, or maybe it was someone else. Yeah. One thing that I have done in the past and found it helpful, even though I think we weren't, it still can be an awkward thing and an uncomfortable thing to do. But when I was working in substance use prevention, we made like a really big push around, you know, destigmatizing language and using, you know, person first, you know, strengths-based language. And we made that more of a norm in our meeting spaces. And so it made it a little bit easier for when someone is using more stigmatizing language for everyone to feel comfortable with calling them in. So it doesn't feel like something that's just like, whoa, you know what I mean? Like, why am I being attacked? Or, you know, just taken off guard. You know, so I think that was something that was helpful, because then we're in a space where we've all already agreed to this norm and we said that we were going to try to do it. And therefore it feels a little bit more comfortable to name it and interrupt early. But again, it still wasn't an easy thing to do.
Absolutely, yeah. And that's, you know, that's part of the reason why we do things like set group agreements, so that we know what type of space we're holding. So I love that point. Lele, feel free to correct me if I mispronounced that. I think you were next.
Thank you. It's Wala. I think some of the, so I tend to practice using these, and I think some of the difficulties that I find happening is the conversation is harder to have when there's power dynamics involved. And so like oftentimes interrupting or being direct and objective is not like feasible because of like the risk that could have in power dynamics. So even as somebody, and you know, like I like to pride myself in my communication, and I'm okay with like confrontation that's not harmful in that sense, but there's still a risk of what if this person who I know like has X power over me uses that in some other way. And so wondering if you have suggestions for strategies to kind of maneuver around that or alleviate some of that.
That's a great point. Yeah, I think we did talk about this as trainers when we were building out this training, and decided that, you know, power dynamics could also be a 7-hour training. But thank you for naming that point. And I'll be honest, I don't know if I have the answer, right? I'm maybe similarly to many of you, not at the top of the hierarchy in my organization. I have certainly felt those power dynamics personally at work. So I'm gonna throw it out to you all. Do you have strategies for times when you've really felt those power dynamics and you've wanted to interrupt harm, and how you went about that? And I'll invite co-facilitators as well.
Yeah, sometimes I try to find somebody that's in like an ally or like a comrade in any of the situations. Sometimes I try to figure out if it's better written and not like verbalized. Sometimes it helps, sometimes it doesn't. I've had experiences where the written helped. I've had other experiences where the written did not. And so it kind of worked against my advantage in that case. So I'm not really sure. I think I'm still kind of learning to figure that out as well. I still always feel better when it's communicated. And so like personally, it has an impact on my like agency of correcting or like verbalizing or even communicating like something that's made me feel uncomfortable. And so, yeah, I like you don't have an answer.
Other folks have thoughts?
Yeah. What I have done in the past is trying to, because yeah, when you are in a meeting or in group, I think that I don't feel comfortable putting the other person at risk because of the power dynamic, or because of the stigma, or because probably it's a long conversation. Sometimes it takes time, because it takes time to understand what's the position from the other person. So initially what I do is asking for consent to let them know something that makes me feel uncomfortable. And then when they are ready, I can start saying, this is what happened, that's how I feel. Can we try to improve it? What do you think? And but this is a long conversation. It's not one minute conversation. And then if that situation gets repeated, I can go to a different levels. But I think that not everybody has the has processed this information in the way that we are doing. Sometimes when you are in the justice field, you know, in the social justice field, you get more information than other people. And I think that is fair to let them have a private space to process it also.
Definitely. Thank you so much for naming that, Olga. I think that's a great strategy. Just saying, like, can I give you some feedback in this moment, right? Or if you think the answer might be no, maybe having that conversation privately. I think that's incredibly valid, and I want to honor that. And Gihan or Jihan, feel free to correct me. I don't want to ignore your hand.
No, it's Jihan. Thank you. What I'm going to say is probably is indirectly to keeping conversation focused on the problem. It might be silly, but it's just something that's a strategy that I always had taken, especially when I'm working on like if I'm going for a training, for example, and there is like a several days training. It's usually the first day I go there just so I can make sure that the conversation and the topic, people are focusing on the topic, not on me per se. So as a Muslim in the past, since September 11th, since Boston Marathon bombing, there's like all the stigma about the Muslim people in the state. So me going there with the scarf, like the hijab, wearing the hijab like that, it's sometimes, you know, it just, when you enter the room, you feel like people are blocking you from the conversation, or even, you know, just focusing on the clothing your head more than what you say and how important you say is. So what I've been doing since ever is I actually not wear it this way. I wear it like a turban, which is a lot of people wear it as like a hairstyle, or like it's just a style, until people know who I am and they listen to the conversation, listen to the point I do as a, more than to looking and judging me on the stigma that they already have. And then the next day I'll be coming back wearing the scarf this way. It's just, maybe it's not something related to language per se, but it's actually it's more to the like keeping conversation on the same level where focus on the topic rather than just on the person, on how people view the person.
Yeah, thank you so much. Sorry, Gina, I saw you unmuted. Do you want to jump in?
Yeah, I just sort of having a thought in my head, so it's still sort of kind of forming, but looking at these first three kind of boxes, it reminds me very much of, I don't know if there are any parents in the room, very much of like when you're trying to talk to a toddler and when you're trying to like change a behavior for somebody that still has a lot of things developing in their brain, right? And so part of that changing of the behavior, I have a 3-year-old, so it's something that I do very often, is doing this, like being direct, like being sort of like not like taking away the emotion out of the situation, being direct with my language about what I want her to do or not do, especially if something is like unsafe for her. I don't want her to get hurt, and like being very clear. And part of the success of those strategies is the repetition, right? So this first thing of like making sure that you catch it early and you always catch it, right? You're naming that this is a problem and it's continuing. And then the other part of like correcting toddler behavior or like making sure that they're safe is like the setup of it, right? Like trying to avoid it becoming a problem in the first place. And so part of the parallels that I'm making here, or like the connections that my brain is like trying to figure out, is like perhaps this is like something in our workspaces or in the spaces where those power dynamics are at play, is something we build up to, right? Something that we're trying to like create space for ourselves to get there. And it might not be something that we achieve right away, especially when those power dynamics at play, but like situations that we can start to ebb and flow. I love all the recommendations that folks are making in the chat box, some really good stuff there. So definitely encourage folks to check it out. But yeah, sort of like the buildup of like, how do we get ourselves to this place where we can do all three of these things? And it could be something that we chip at little by little.
Definitely. Gary, go ahead.
In particular, on the tails of what Gina was just saying, the piece of that I really like is the takeaway for me is that notion of it's not going to be one and done, probably. And even though in most of the worlds that we're dealing with, adults aren't 3-year-olds. Yes, they are. So I think that's the important piece, is that it's not one and done.
Absolutely, yeah. And you actually named something that's one of our values is positive youth development, right? And thinking about, would I say this to another adult, right, when we're talking to young people? And I think what you just said, Gary, it's the same thing sort of in the other direction. So why do we assume that, adults need like this whole other set of language to be talked to? They don't, right? So I want to keep moving through some of these strategies. So we named a couple of them, I've heard. So specific resources, I'm seeing things like that in the chat, right? So one of the things that you can do is like offer folks resources, especially if you're having a longer conversation, right? Or you're doing this in private, like you can say, I went to a training and I saw this really great sheet that said, say this, not that, like, would you be interested in reading that? So you can direct people to things that might help them better understand where you're coming from. And also, I don't remember who said it, but someone named involving other people in the conversation, right? Bringing in those allies, especially if there are power dynamics, especially if you are holding identities that are putting you maybe in a position where you could be erased or overseen or not heard, right? Depending on what you're bringing into the space, bring in your allies, call on your Gracie and your Jasper and your Gina and bring them with you into that conversation. It's okay. You don't have to do this alone, right? You don't have to be the only one who's responsible for interrupting harm, especially if you are the person being harmed. I want to make that really clear. If you are the person being harmed, you do not have to do this alone, right? Call in those people, call in your allies. Okay, so diving back into a couple more of these before we go to break. I want to make sure we get our break. I just want to name the last couple. Could I get somebody to read for me the fourth one, if I can count, that starts with remember that? Someone please read that for us.
I can read it. Remember that people will use types of denial.
Thank you, Kate. And the fifth one, appeal. Can someone read that for us?
I can read that one. Appeal to the person's sense of empathy.
Awesome. And then the next one, meet all. Someone else, please.
I can read it. Meet all involved where they are.
Thank you. And we got one more. Who wants to take this last one?
I can read it. Appeal to established values and mission.
Amazing. Thank you. So I think you have all really touched on these in a lot of your comments already, but just to sort of name them all, people might deny what they said, right? I think, again, I'm trying to use I statements, try not to generalize, but I might say something like, oh, I didn't mean it that way, or, oh, you're misunderstanding, right? That's something you might encounter. And it's okay to push back against that, but just, you know, it's also good to expect that that might be a response that you get. Not everyone's going to be immediately willing to say, oh yeah, I caused you harm, right? Or I caused harm in this situation. And that sort of really ties into meeting people where they're at, right? So if you know your audience, especially, and a few of you have mentioned this, if you're thinking about maybe I need to ask them before I give this feedback, maybe I need to pull them aside. Sometimes the most productive conversations are ones when you really know like where folks are coming from in terms of the situation that's happening, right? And then appealing to someone's empathy. I would like to assume that most people are inherently good. I try to be optimistic about that, and I think this one can be really helpful, right? If you're appealing to someone's compassion, to their empathy, that can maybe get you faster to where you want to be. My mother likes to say, you catch more flies with honey than you do with vinegar, right? And that doesn't mean you have to suck up to people or you have to be overly kind, right? It just means that sometimes if you approach it with more positive language, or if you say, you know, I feel really sad or embarrassed or hurt, like that will tug on someone's heartstrings, right? And I would like to think that most people are going to be responsive to that, right? I would like to think so. Anyway, don't tear down my visions of humanity yet. Okay, and then the last one, which I think we sort of danced around a little bit, is just appealing to missions and values. And this is like very, I think in my head, very work specific. So if I was in a meeting with my colleagues and I said something like, you know, this population, pick any population of your choice, this population doesn't deserve our help. That's not great, right? So that's a good chance for Gracie or Jasper or Gina to jump in and say, you know, Tanayo, I hear that you're frustrated about this project, but, you know, supporting communities to be healthier and to advance health equity is really our core value at HRIA. And like, maybe this is a project you could consider not being a part of, right? So it's good to, especially in the workplace, appeal to those values, appeal to your mission. And I want to make sure I'm not ignoring the chat completely. You guys are just going off. You're going off. I love it. Let's see. Oh, I love this calling in culture versus calling out culture. This is wonderful. So I'm kind of scrolling through this. Are there any thoughts or reactions to the rest of these? Anyone have things that are coming up for you, things resonating, things not resonating? Would love to hear all of it.
I have a pretty great story that kind of is this exactly. I don't know if it would help to put it in perspective for people, but I, a few months ago, was in a situation where somebody was saying something relatively hurtful, and I didn't have enough education personally to kind of be like, this is harmful, these are the reasons why, and here's the education about that. But thankfully, it was brought up in a place where there was other people, and my supervisor took that challenge on, interrupted, said it was actually the topic of homelessness. Somebody was referring to these people as, you know, jobless, dirty, any of those things, you know, all of the stigmas that come with people who have housing insecurity. And she was like, you know what, in those situations, we really have to look at the built environment. You know, what is causing them? These people are probably not jobless. You know, put yourself in that situation, and, you know, if your life didn't go exactly the way that it is right now, you could be in that position. So thankfully, you have the structure within your life to allow you to have a house and family and a job that pays you enough for this situation. And then she was just kind of like, oh, you know, I was just talking about the fact that I couldn't get a parking space, not like we didn't need to go here. And then everybody else was like, absolutely, we needed to go here because you were obviously uneducated in this topic. So thankfully, you know, that got brought up and was educated. And I feel like hopefully after that conversation, everybody had a better sense of housing insecurity and how that affects, and, you know, the environmental aspects that is affected. Hopefully that made sense and wasn't just me rambling about that. But I feel like that is this exact situation.
Absolutely. Nailed it. That was beautiful. Thank you for sharing. Let's take Chris. Looks like you have your hand up.
Yeah, I was just gonna say this kind of reminds me of kind of when I've talked to either like family, like my dad, or friends. I feel like they're like super kind, nice people, and they're amazing. But just like every once in a while, you notice a blind spot that certain people have, and I have plenty too, and everyone does. So I guess kind of like if they're super kind in all these other ways, but like they just don't know as much about other issues, kind of just remembering that. And it definitely goes along with all of these, just like kind of bring them up to speed about how, oh, isn't that similar to this other person that you know, or kind of tying it into their shared experience so that it's not, cornering them, it's not judging them. It's just like reminding them of their beliefs in a lot of other similar ways so that they can kind of tie it into a new lens to look through.
Absolutely. Yeah, making things personal. I do that all the time with my parents. I love that. Malika, go ahead.
Hi, thank you. I just had a recent, I'm having a current experience. It's not folks from my agency. I am an work group with other people, and we're talking about systems, and they are in public health, but it seems as though they don't understand the social determinants of health, and that institutionalized and structural racism actually affect those, because the entire conversations we're having, I'm just like, and it's amazing to me that they actually are public health professionals, and it appears that in some of the work, to me, they're just causing more harm than good, period, because their whole concept of what they were taught in school and everything else, they don't see language. It's just like, wow. And so every time I get into a meeting, I'm like, okay, what's going to happen now? And how do I maneuver this way? It's almost like I'm re-traumatized every time I have to go to this meeting. And it's not just like one, it's, we have to interface with other organizations and other agencies. And it's always not that simple when you have to do that interface.
Yeah, absolutely. I think you named a lot of things there. One of the biggest things I think that I took from helping build out this training was really this piece around meeting people where they're at. And that can be really harmful for us, right? And I think something to acknowledge in this space is that, I think this is a really wonderful group and you're all doing amazing work. And you all seem like really, really thoughtful individuals, thinking about things like language, thinking about how our language impacts people. But not everyone is there yet, right? And I don't mean that as a shaming statement. I don't mean to pass judgment. It's just true, right? Not everyone is thinking about these things. And it can be a lot of work to have to take on that challenge of getting people to think about these things. So I'm going to pause there, actually. I think we're going to give you all a quick break, but I want to encourage you to keep putting things in the chat. This conversation is not over. But we do want to give you a break, a bio break, a music break. But thank you all so much for everything you've contributed so far. So I think we're going to throw up a timer, play some music, and bring you back in about 5 to 10 minutes. 5 minutes. Okay, great. Thank you all.
But we're going to think back to those brainstorms that you did at the beginning. So in your small group conversations, when you were thinking about times that you've heard stigmatizing language or harmful language used in the public health context, in your work context, in your personal life too, if you want to bring that in at this point, we're going to ask you to think about those. So hold those back here in the back of your head. And then we're going to ask you, not yet, but we are going to ask you to get into small groups. Pick one of those scenarios, or we're going to present you one, so you can use the one that we do as well. Pick one of those scenarios and then create a skit, very short, like 1 to 2 minute skit, thinking about the strategies we just talked about. So thinking about how in the moment, if you heard that language that maybe you've heard on the TV, in the news, if you heard it at work, what would you do? How would you interrupt it?
So we're going to give you an example of what this is going to look like. We are going to portray employees at a public health nonprofit, haha, very on the nose. And we just want to note that this role play is really meant to illustrate how harm can be interrupted. So if any of the language is maybe a little bit triggering, we just want to name that. We did try to make sure it wasn't going to be superbly harmful, but it is meant to demonstrate like how harm might come up. So just take care. All right, I think we're ready for our role play. So if everyone can give us like a lights, camera, action. So lights, camera,
Lights, camera, action. Well, that was an interesting all staff meeting, I'd say.
For sure, for sure. Very strange that what we spent a lot of time talking about.
What do you mean by that, Tanaya?
It seems like a lot of time was spent harping on the fact that we only have feminine care products in the women's bathroom, and I'm really not sure what the big deal is.
You know, Tanaya, it honestly feels like a little bit weird and uncomfortable that you said that, you know, like there are women who don't use those products and there are men and, you know, non-binary folks who do use them. That's why we're talking about putting those products in all restrooms, not just the women's restroom.
Yeah, thanks for naming that, Gracie. I feel similarly, and I don't know, I think it's important that like we call them what they are, like menstrual care products or period products.
I really don't think you understood what I meant. I think you misunderstood me.
Yeah, I mean, regardless of how you meant it, I think it still came across pretty harmful. I know some really great resources, Tanaya, like from organizations that work on menstrual equity. Like I didn't know about this stuff until I read it, and I feel like a lot more informed and educated. And I can definitely like send those along to you. I found them really helpful. Like, would you be open to that?
I think that's a great idea, Gracie. I'm happy to help out and, you know, support as well. It's definitely a learning process.
That would be great. Yeah, thank you. I'm sorry about what I said. It was clearly uninformed. I'm looking forward to reading more. I guess I have a lot to learn.
Yeah, that's okay. You know, we're all not perfect, but I think it's a really good starting place. So I'm glad to hear that. I'll make sure to send those to you by the end of the day, Tanaya.
All right. What did you all notice in that role play? What were some strategies that we used or things that came up? Go ahead, Malika.
You received the information. Okay. I saw that he brought in help. There was an ally that supported the position. And I've had an experience where it was just dead silence. So then we just sat in silence and I let them eat the silence until we were able to move forward. But I would just be interested in knowing if you would actually look at the materials and if there's any type of next step in terms of in that regard. So thank you.
Yep. So you named a lot of them, right? There was allyship. My character, just for reference, this does not in any way reflect my personal views and opinions, but my character of Tanaya was like somewhat reluctant, but like eventually accepted the feedback, right? There were resources provided. It was interrupted early. Absolutely firm and no nonsense. Yeah. And Jasper made sure to ask what I meant, right? Didn't just assume that I was trying to be transphobic, right? So they made sure to ask. Yep, good job highlighting in the moment, non-judgmental, direct, absolutely. Any other thoughts or reactions? Things you noticed? Yeah, no one is perfect. Good way to ease the tension. Yeah, eye rolls early on were important to the character. Yeah, absolutely. Alva, go ahead.
You guys you all sounded, sorry, like very professional, but I just really have a hard time, not feeling like, attacked or, I know the purpose is like for others to learn. It felt kind of like gaslighting. That's the first thing that I felt. This is like gaslighting. Like, no, I didn't. You took it the wrong way. So I just need to, find ways to kind of not feel, feel more professional and attacked.
Although you named something really important, which is that you're talking about professionalism, right? And we are operating in white supremacy culture, right? And professionalism is one of the pillars of white supremacy culture. And so feeling attacked, feeling upset by things like when people say, oh, you misunderstood me, that's incredibly valid. Like, that's super valid that you feel that way. So we are presenting these obviously sort of in the system that we are in this white supremacy culture, in a workspace. But your feelings are valid, and I put that out to all of you. However you're feeling in the moment when things like this happen, like, it's okay to feel that way. It's okay to name that. Don't let people gaslight you, for sure. Jamia, go ahead.
Hey, I just kind of wanted to add a little thing to add to what you just said, Tanayo, is because I feel that, this is a lot of labor to do this. And perhaps sometimes it's good to have people in the organization that can take leadership in this area and perhaps add like mediation, because I don't think everyone should have to go out of their way to communicate like a valid feeling or harm is being done to them because they're not saying it in the right way. So sometimes it's worth it to just try to find someone else who can help you communicate, because just you don't have to do the extra work when someone's already hurting you, So just some context.
Absolutely. Yeah, I could not have said that any better, so I will not add to it. But I see Kay also raised their hands. If you wanted to jump in, Kay.
Still mute. Okay.
Hello,
Hello?
go ahead.
Okay, I thought the feelings were hurt. I think that there was good intention on part of the speaker, and I think that there was a strong emphasis on trying to fix somebody that didn't need to be fixed, but more needed to be informed. And I think some kind of a gentleness and support of a person willing to learn would have been more helpful, and she would be more eager to be engaged. I don't think there was ill intent. I think often there is ill intent, and that needs to be addressed. But in this occasion, I think the person actually didn't have ill intention and was open to change and to new information. And I think she needed some kind of less of a reprimand, less of you're broken, you need to be fixed, and more you're a willing learner, and we have lots of resources and good things that we can teach you so you can excel at your job.
Thank you, Kay. I think with that, unless there are any questions, I'm going to go ahead and move us into those small groups. So again, just a reminder, you're going to try this on now. So you can use the example we just gave you and sort of recreate the script, or think back to those brainstorms. Think about one of the situations, scenarios, language that you've heard, and think about, in a workplace setting, if something were to come up like that, how might you interrupt that harm? So I'm going to recreate those breakout rooms. If one of my colleagues doesn't mind popping those instructions in the chat. I just want to make sure, is anyone confused about what we're doing? Any questions? Creating skits. You're welcome to try it on. So actually practice running through your role play, through your skit that you create, but you don't have to. So no pressure.
All right. There we go. There's your sign.
Awesome. Thank you all for indulging us in that activity. Before we do a debrief, actually, I want to start and see if anyone, any of the groups, want to read their skit, want to put on a role play for us. You don't have to, but if you came up with something really great and you're like, we want to share this, I want to give you that space now. Yeah, someone please do it. Thanks, Ashley. Anyone?
I don't know if we could recreate our script because it was pretty intense, but I felt like in my group that we did a good job. You know, and it led to when we debriefed afterwards, some real life stuff that was happening recent. But I don't, if anybody else in my group, because of the way I have this set up, wants to go over.
Yeah, hi, this is Jenna Montgomery. So we talked a little bit about,
here we go,
some of my work with like substance use and some of the language around that. So we did a little skit and then we debriefed after. And I think it went really well and the group was wonderful. You know, I had some questions that came up as like I went through just like deciding what I was going to say. And I did use some of the language and strategy from the role play we watched you all do. I was talking a little bit about how I tend to struggle with like just in general in our culture overall, I am a person who struggles with interrupting and I'm always envious of people who seem to know, like, I spent 2.5 years as a therapist, so it's kind of funny, but just kind of calling myself out on it. Like I know people who are very good and like very skilled at it. And I think that one of the things that came up that was helpful for me is it doesn't always have to be a hard and fast, I'm stopping the conversation here interruption. It depends on the conversation. But if there's like a teaching moment or a correcting moment, right? I think as Darlene was saying, you can kind of, you know, if somebody uses the word, oh, that junkie, you can say person who uses drugs, please continue, you know, like, being able to just correct their language in that moment and like continue the dialogue. And that I think was a nice perspective shift for me.
And then in our skit, you know, I listened as Jenna was describing a program that they wanted to get up and running, and it was going to be next to my building. And, you know, so I listened to her proposal and what they planned on doing. And then I shot back at her that, you know, well, I don't really want those junkies hanging around, you know, and dirty needles all over the place in front of my building where I serve kids and everything like that. And she listened as I gave my reasons why. And then she gave me some suggestions and provided me with some resources to rethink the language that I was using and my view, how I viewed people who use and help me to be able to reframe and understand better who she was serving and how the population she was serving could collaborate with the population that I was serving. And that was very helpful, especially the providing of the resources.
I love that. Thank you. Other groups want to either share their skit or talk about things you talked about, right? What came up? Was it difficult? What questions were you asking yourselves as you kind of thought through these scenarios?
I can go. Our team proposed, well, we didn't really get through a skit. We were more so talking through a scenario and how we would respond in that situation. And one of our teammates shared an instance of like a town hall meeting where they're using very othering language and generalizing a lot of different very negative, I don't know, things about a certain population. And it was really, as we were thinking through just internally for myself, it was hard to think about, one, how do you work when it comes like a mob kind of mentality where everyone's sharing a bunch of very harmful language, and two, how do you address like language like those people? Like, how do you reframe that? How do you get to the point of that in a succinct way when you're trying to understand their intention? yeah, those are the questions I was left with. So I don't, I don't know.
They're great questions. And I just want to, something you brought up that we haven't really mentioned to this point, but if you're in a space and you are the one being harmed, it's okay to remove yourself from that space too, right? Like you do not always have to carry that emotional burden. So I just want to honor what you brought up there. Other folks, responses to what Victoria shared. I see Malika, you just raised your hand. Go ahead.
I just want to say thank you for that, Victoria. You said we meet people where they're at. And it brought me to a question in terms of meeting people where they're at in the group where we were working. And then it brought up a question to me in terms of the overall training. Are people here because they saw the training and said, oh, this looks interesting, I'd like to know more? Or were they here because there was someone in their office or perhaps a supervisor or someone that said, I think this is something you may, that you may benefit from, and ask the person to actually attend? And so I think the level of participation is a little bit different based on that kind of perspective. And those were just some questions that came up in our group. That's all. Thank you.
Absolutely. Yeah. Penelope, you raised your hand. Did you still want to share?
Yeah, sure. I was in a group with Victoria, and so thank you so much for sharing. And something that I was reminded of as you were sharing was role playing for the times where the language that was used is like explicitly, like there's no way around like how problematic it was because of maybe the language or like the level of violence. And then the other times where it's almost coded a little bit. So it's like the thing you're saying is very problematic and you're saying so much with the thing you just said, but and sometimes that means that you'll have a different approach to the conversation with that person, if at all, right? If at all. So thank you.
Absolutely. Yep. Stina, go for it.
Something that came up in our discussion, which I thought was really interesting, was sort of like the overwhelm of trying to make sure you're always including everyone and every single possibility. And we talked a little bit about just like having an open mind, because the term that was used was kind of like, well, where's the line? Like, at what point have I like included everyone? Where's the line? And we talked about kind of like everyone has a different line. And so there is no one line, and having an open mind and being able to like kind of meet people at the point where they feel comfortable is what's important, and kind of like the ongoing process of learning. Because if we aren't living that experience, we may not necessarily, I mean, we should try our hardest, but we may not necessarily always know like what someone else needs. And it's not to put the onus on them, but it's really just to listen to what other people need and have to say.
Love that. Autumn, go ahead.
Yeah, we were talking a little bit about how sometimes, especially for people who like aren't super familiar with this language or haven't been exposed to this language before, there can be this kind of pressure to like almost that you can't say something unless you're going to be using the right language and the right vocabulary, and like how difficult that can be to draw the balance between like letting people ask questions and learn and like speak honestly about how they feel without also, you know, perpetuating harmful language and continuing to cause harm, and how it's just like a kind of tricky balance to find.
It is, yeah, it's a balancing act. And I think something that you're all bringing up here is that we're trying, right? We're trying really, really hard to be thoughtful and to be inclusive. And sometimes we're going to mess up and we're going to make mistakes, and that's okay, as long as you keep trying. That's what I always tell my parents when they're like, oh, I don't understand this new language, blah, blah, blah. I'm like, well, it's okay if you don't understand it yet. Read about it, try it out, try it on, keep trying. Go ahead, Stacey. I saw you raised your hand.
I think it's also important, and this is kind of something I was thinking about as you all were just talking, to recognize that some people are trying to cause harm. I mean, I know we want to just really consider that people are good people, right? I'm kind of with you, Tanayo, on wanting humanity to be better than potentially maybe. But I think that that's important. And so in that same thought wheel, we need to make sure that if you are, calling someone in, you're maybe not doing it by yourself. It could be potentially dangerous for you, not necessarily physically, but emotionally, and or if they have some measure of authority over you, it becomes a he said, she said. So you have to also be really kind of real cognizant of that. And I don't want to be like that person, but that's just the unfortunate reality that we live in.
Absolutely. Yeah, I think, we like to assume best intentions, but you're right. Some people don't have great intentions, right? Sometimes they really do intend to hurt us and to harm. So thank you so much for bringing that up into this space. Other folks have thoughts before we kind of transition to the next piece. Just want to make sure I'm not cutting anyone off. Kay, I see you have your hand up. Go ahead. I think you're muted.
Okay. So my group, basically, everybody seemed to have good intent. Xavier, and I'm not the person that really brought this up. One of my partners did. So correct me and jump in and do interrupt if I make any mistakes. Xavier, a Catholic school, very prestigious and very good, was supporting Black Lives Matter and had served Kentucky Fried Chicken on February 1st. And this would sound like a good idea. The suggestion came from the chef, who happened to be Black, it somehow or another got soured and it got into the paper, and Xavier kind of did a very wonderful media PR press thing where they explained their good intentions and how important it was for them to support Black Lives Matter and be very politically PC. Nobody saw any bad intention in any of it. So, that there wasn't the undercurrent line that people felt that something else was going on at this, prestigious school. And one of the things that happened in the end that was brought up by one of our at our group was that it was ingenuous. Some way or other, the whole event turned out to not do a good thing for either the white or the Black community. It felt that the picking of Kentucky Fried Chicken was a financial success. This is a Black agency that had, and so the intent of showing Black Lives Matters, Black people can be successful, etc., and was a teaching moment to show that there's a track and that business and financial advancement happens in the Black community, and that teaching moment got lost. And so in the end, there was a sense that everybody tried to do well. We were all PC, but in the end, we were disingenuous. And this was a very important kind of topic, because basically, somehow or another, the undercurrent and the essence of long-term healing between the Black and the white races was an opportunity was given. It was in good intent, and it failed, and the white folk didn't realize it. And I think it was brilliant. And the question of, is this genuine? Is this real? And is it real for both the white and the Black community? It needs to be answered more often. And I totally agree that frequently we're dealing with people with very bad intent. And that's dangerous and scary. If anyone has to say anything else or correct me, I'm totally open to correction. Thank you.
I'm going to give Davida, if I said that incorrectly, please correct me. Give you the last word before we transition.
No, you absolutely said that right. Thank you. I think what Kay brings up is something really important, that a lot of times we're just not asking. there's in that white supremacist kind of institutionalized racism, there's an assumption that the people that you want to work with don't actually know what they want and that they're incapable of making those decisions. So the assumption is, oh, we're going to do this for you, without actually having a discussion around what it is that they truly want in the context of what's happening. For example, if you have that kind of situation, or we want to, I think at one point where I am, we had a campaign where we were trying to get testing into food banks. And I asked the question, well, why do we need to do that? And it was mentioned, well, we want to get more unhoused residents to get vaccinated. Okay, but what does that have to do with testing? And why in a food bank? Because the last government shutdown, the majority of those that were going to a food bank were government service agents. So there's this stereotype and disconnect between, did you ask them what they wanted and where they were going to be, or did you just make an assumption about where it was going to be? Much to Malika's point of, in public health, sometimes what we've been taught versus what we're actually seeing do not align. And it's really hard to get veteran public health professionals to change their mindset about how they're approaching their work. They don't see it as a methodology so much as they see it as like a mantra and a gospel. And that's honestly where I think, at least in the current context of this pandemic, where we've had a real struggle.
Yep, I cannot add to that at all. That was very well said. Thank you. So with that, I'm going to transition over to Gracie for our next piece. Thank you all so much for participating in that section.
Thanks, Tanayo. And thanks everybody. I feel like why am I facilitating? I could stand it over to one of y'all. But really great points. You know, I don't want this to be like, oh, now we got to do some work and like, how can we bring this back? But I feel that that's often like a theme in trainings, right? Like we gain all these great skills, we gain these great frameworks, we're able to practice these skills that we've learned and that we've kind of accrued over going to trainings. But a lot of people struggle with like, okay, what do I do now? Like, how can I take this back to my work? And I think a training is really like the beginning of something, right? It's not like I take a training and then I end the training and then that's it. It's the beginning of something for you all in terms of how you can take these strategies back to your workplace and how we can be more thoughtful about centering language, hopefully in the pursuit of equity and health equity. And I feel like, you know, we've alluded a lot to power and power dynamics already throughout this training. We're going to sort of give you an opportunity to think about work plans and what you would like to go into a work plan. And, you know, this can be really hard, especially if we're junior level staff, lower level staff, if we're staff of color, sort of gender dynamics, racial dynamics, sexuality, gender identity, sexual orientation, whatever is at play. It can be really difficult, right? If we are the people who don't hold power in our organizations and we have to sort of level up to people, right? I would say most of us maybe here are what we would call like middle managers, right? We have maybe supervisees, but we also need to report up to people, to our supervisors, to managers, to executive teams. So I just want to honor that and acknowledge that. And I do want to say that like workers and employees hold a lot of power, whether we realize it or not, right? Like there's a labor movement because of employees. We have a weekend because of employees. We have safe work conditions because of employees who lobbied and who fought and who demanded that we have safer conditions, right? And I think that we can harness that power. I'm going back to what someone said earlier, like trying to harness the power that we already have collectively in our organizations to hopefully influence and make some change. But like, stay tuned for the next CHTI training that we do, which may be on power dynamics. But just want to give folks a little example of a work plan. There are really sophisticated work plans. There are really kind of detailed and complex work plans. There are really simplified versions of work plans as well. We're going to drop a link that has many different types of work plans. And I want you to sort of pick something that's going to work for you, that feels accessible to you, that feels digestible to you. And we're going to sort of prompt you to think about what are some things that you can take back to your work to hopefully center language and center equity better? Apologies, I think this got slightly cut off at the bottom, but just want to take you through a really kind of basic example of what a work plan can look like, right? And this is like when me, Tanayo, and Jasper got together and we're like creating this training from scratch. This is kind of like the process that we went through, right? So here's our goal that we have, which is in the top left-hand corner. So we wanted to create a training around language and equity. Pretty basic. That's like what you want to accomplish, what you want to do, right? How do we accomplish goals? Well, we have to take steps, right? We have action steps, right? And those are the three things that are below the goal. So what's the first thing that we do? Well, we need to meet together, right? To brainstorm the agenda, the curriculum, what we want this training to look like. So Tanayo, Jasper, and I met, I want to say 3 or 4 times from November to January to sort of plan out what this looked like, right? Who was responsible for that? The 3 of us were. How high of a priority was this? Well, it's not like we had to do the training in like 3 weeks and get it all crunched and ready to go in 3 weeks. We had a bit of time, but it was still a priority. So it was like a medium priority for us. Important to think about the status of the action steps that you're taking. When was this completed? When did you start it? When did it end? Do you want to add any notes around that, right? So we met 3 times. Another action, we wanted to finalize sections of the agenda, right? It's great to have all these ideas that are coming out of our heads in our brainstorm sessions, but we need to make this like easy to read, easy to follow for us as facilitators. So that was a big action step for us as well. And I would say that was a high action step because that also led us to creating the slide deck, right? To bringing it back to the CHTI team to look at together, to give feedback, to give input. And so this is like a really simple goal, but you can see the different action steps that we've taken, who was responsible for those different actions, how we sort of prioritize this, right? Was this a really high priority? Was this medium? Was this low? When did we start this? When did we end this? And then just sort of keeping notes for yourself in terms of how the action steps are going. This is a really basic work plan, right? Really simple. We can get fancy and we can add in like methodology and evaluation and like how we're going to measure the impacts of our goals. For any of my like research and evaluation friends who do that in public health, bless you, I'm never going to do that, but someone's got to do it in public health. So I'll leave that to y'all. So there's like a range. I think what I'm trying to say is there's a range of different work plans that y'all can think about. So how can we take something like this basic template of a work plan and how can we think about centering language in the pursuit of health equity? So you're going to be tasked with so we're going to put folks into groups of 3 to 4 people. And I believe Tanayo or Jasper is going to drop the link to a document that we have that has many different types of work plans on it. And you can feel free to like use one, you could mix and match some, you could use a completely different template, you could work off the basic ideas of a template. I want you to do whatever you think is comfortable, feels accessible, feels digestible to you. So in these groups of 3 to 4 people, you're going to be in these rooms for about 10 to 12 minutes. And in your groups, looking at the link that Tanayo or Jasper is going to drop in the chat, we want you to think about, okay, what are some goals? What are 2 goals that you have for yourself, for your agency, regarding language and how to be more equitable and center language in the pursuit of health equity? And these are the 2 questions that we have. So we want one goal to be kind of like a proactive goal, right? So this is something ideally that we are putting in place to prevent, maybe harmful or, problematic things that are being said within our agency. So maybe that's like our employee handbook is being updated to reflect more person-centered language. Maybe we're codifying something about how clinicians should be using person-centered language when working with clients or participants, right? And not using terms like addict or junkie or druggie, right? Just for the sake of like, if you're in the substance use world, okay? So those are proactive things. Like what are some things, how can we update our policies or put things in place that will hopefully prevent harmful language from being kind of used in our workplace setting? So that's one goal. I also want folks to think about another goal that is kind of a responsive goal. So, if we're in meetings together, if we're in all staff meetings, if we're in meetings with external clients or partners, and something is said, something harmful is said in those types of situations, how can we have a responsive policy or like goal that allows that harmful thing to be addressed in the moment, right? Because I think a lot of people have alluded to, and I know Tanaya alluded to this also, like, oh, I wish I had said something in that meeting, right? Or I wish like this had gone differently, or I wish someone had spoken up and said something. And this can be really tricky, right? Like it can be hard to respond in the moment. And we've gained some really great frameworks, I think, and hopefully some good skills around that. So how can we codify that? How can we put that into a goal, and what are some action steps that we can take to make that goal a priority for our organization? So we didn't want it to be like just one or the other. We wanted to focus on a proactive goal and a responsive goal, because, you know, it's likely that, you know, people are not going to stop saying racist stuff in meetings tomorrow, or problematic things in meetings tomorrow. And maybe that's why we have, why we're proactive and maybe update our handbooks, our policies, our internal procedures and practices, but then also what's something that we can do in the moment to be more responsive. So I know that's a lot. I'll pause, see if there are any questions. The directions are in the chat. The link to the template that has many different work plan templates is also in the chat. I implore you to click that. Otherwise, I think the chat disappears sometimes when we go to a breakout room and we can't access what's been put in it before. But I'll just pause and see if there are any questions, thoughts, anything that I can help clarify before we send you off into these breakout rooms. And sorry to our friends who have to hop off early. We enjoyed having you, but I don't see any questions coming through or like confused, lost faces. So I will let Jasper or Tanaya work their Zoom magic, send you off into these groups for about 10 to 12 minutes, and happy work planning. We'll debrief once y'all come back. Oh, thank you for doing that, whoever clicked that. Alrighty, I think we've got all our friends. We may have lost a few people. I think we had 63 prior, and we're at 60. So I'd say we didn't lose the bulk of you. So I'm glad. Well, hopefully that felt like a good, fruitful conversation. I'd love to hear from maybe like 2 to 3 different folks, just to sort of tell us about, you know, what goals you've set for yourself or for your organization. And what do you feel confident about? What do you still feel like you need more guidance on? And how do you think you'll determine whether you were successful or not with your goals? Would love to hear from maybe 2 or 3 folks, if there's some brave and lovely souls who want to unmute themselves.
This is kind of, oh, I was going to say, I totally cut off somebody in the group. And if there are people in my group who didn't get to share and wanted to, I hope you will, because I really wanted to hear what people had to say. I think I talked too much. So I'm sorry for that.
No worries, Nina. Maybe someone from your group, I'll pick on them in maybe a minute. But Rob, I saw you unmuted and had a thought and wanted to share.
Yes, so I was actually in the group with Nina, and I think that 2 things that I saw as extremely progressive and necessary, especially for me where I am. We discussed having rules of engagement for staff, where we talk about how people have their own personal best practices and how we can have people, you know, kind of define those for others. So that way we can find the best way to work collaboratively. And then also in terms of responsiveness, I would say that at least like where I am, we do a pretty good job, but there's always work to be done. And as I take my work day by day, I notice some things that I need to improve. So maybe just being a bit more upfront with leadership about what needs to be done. and having the bravery to, kind of stand up and say, like, this is wrong. Maybe we shouldn't be doing this for that. Because I think that oftentimes, like, we come across points and opportunities where we're worried about deliverables that we need for certain higher organizations, whether that be state or federal. And we're not necessarily doing things for the best interests of the people that we serve. So, kind of just being more forward in that regard. And forming a plan, if you will, to have those conversations, what they would look like, how they should look, what results I want out of them, and following up.
I love that, Rob. Thank you so much for sharing. So I love the sort of engagement, the rules of engagement with clients and participants and maybe other employees. And I think you sort of alluded, like, we're all giving input, right? It's not just like us as the workers or the staff, but like really engaging the people who may be accessing our services, like giving them voice in terms of like, this is the conduct, or these are the rules, or these are the guidelines for how folks should be in this space. I really appreciate that. And I love that you lifted up, like, the institutions who fund us are not absolved of being, racist or sexist or homophobic or like really missing the mark. For someone who works in harm reduction, SAMHSA just released a bunch of harm reduction grants, and they're like not funding certain like drug paraphernalia, despite the fact that that would like save people's lives. So like they missed the mark, and damn, like they're one of our funders. And I'm like, there's a disconnect, right? So I really appreciate you naming that. Stacy, I see you have a hand raised. Go for it.
Tracy, I love your personality.
Thank you.
So one of the things, and I will say, so right now in my company, we are working on a new website. And my job as in low community health is to work on health education and the language that we use, which is just the regular language, but also language access, which for us is 5 major languages. And so that's a huge undertaking in itself. But one of the things that we did this year, a few of us got to take anti-racism training. And I think that that's a huge push that the entire agency, the entire organization needs to be a part of it. Because it's not just about bias and discrimination. That's what people like to, take because it's easy and soft and doesn't really get anywhere. But anti-racism training gets to the meat of a lot of the constructs of institutional racism and then all the other otherings that kind of stem from that. So we're really looking to have more people take part of that. So that's an exciting endeavor, but it's a lot of work, and I think intimidating, but all very necessary.
Yeah, that's great. Thank you, Stacy. I'll go to Walla and then Sammy.
Thank you. Just a couple of points. I mean, we just talked about generally our experiences, but I feel like listening to everybody, I work in the public policy space, and to your point, a lot of the people who work in policy space don't understand the power of language access and what language is, especially when it's vague, and unless we're intentional about using words and like identifying like groups of marginalized identities and like using that specific language to address it. Oftentimes it's open to the interpreter, and like whoever makes those programs and regulations are the interpreters. And so I think something that I've been grappling with is one, not losing hope, because sometimes it really does feel like it's hopeless, especially as like one of very few people of color where I am. And so I think how I feel setting goals is to like keep persistent, and even though it feels like it's consistently going against the grain, that sometimes a grain will pick up another grain and then they'll kind of roll over. And so I think, success has now, for me at least, been measured with like small incremental progress. And it's frustrating. I come from a direct service background and come from a lot of different marginalized identities, both my family and the background I grew up in. But I think, keeping a radical mentality in an incrementalist bureaucratic system is really important to continue striving for that like goal. So just wanted to share my thoughts.
Love that, Walla. I think Angela Davis said it, but the world in like 1922, probably the people who lived in 1922 could not imagine the world in 2022 today, right? And like the things that we're working towards will not happen tomorrow, maybe won't happen in the next 2 years or 5 years, or maybe even within like our careers or lifetimes, but that should not stop us from doing these things, right? And planting these seeds, because I love it. Like one grain picks up another grain, picks up another grain, and like we're able to affect change. But you can't get to change, like the 100th person who sees the change, like couldn't have done it without the other 99 people, right? So that's a really beautiful sentiment. Sammy, I'll give you the last word and then we'll close.
I mean, it's not really big and important enough to be the last word. However, I guess we'll take it. I was just thinking, I'm in school for social work, and I was just in a class where we watched a video about mirror neurons and how people that have autism may be lacking them, and just the language that they were talking about, and how you say, like, you know, people can't relate, people on the spectrum, like these kids. What I was hearing, it may not be the truth, but what I was hearing from this video is like, you know, they can't relate to their caregivers the same way, and it's difficult and blah, blah, blah. And like, that was a thing. And I was just like so upset the entire video. And a tiny little possible thing I can do is just talk to my professor and be like, hey, you know, this video, this study, you know, who was in charge of it? Was it people that were on the spectrum, or was it people that were not on the spectrum? And how would that change if this research was done from a neurodivergent lens? You know, would it be different? And so I guess it's kind of like a gentle calling in. It's just that it felt really important to me because I, you know, as social workers and in school, we are the future of this profession. And if this is the information we're getting, that could be potentially really harmful to the people we work with.
Mm-hmm. Love that. Thank you. And I think, you know, to sort of applaud you and celebrate you all as a group, I think you all modeled really well, like calling in, right, throughout this whole training, and holding people accountable and informing people who maybe just didn't have like the information to convey what they were saying or thinking in a sort of productive or welcoming way. So I think you all like have some really wonderful goals. And like, don't lose hope. Like, there's power in employees, there's power in workers. Like, we can affect change, whether we realize it or not. But that just because I won't see it within my lifetime or my career, that shouldn't stop me from trying to fight the good fight, right? So thank you all. I think I may be passing it to another friend, another facilitator to close us out. I don't know who that is, or I can do it. I'm
happy to say goodbye to everyone, but I know that the chat box is going very fast, but I want to make sure that you all didn't miss our feedback form. We are in the time of the year where we start to build our training calendar for next year. So I saw some training requests for Power Dynamics. If there is anything that you want to see from us as a training institute, please let us know. Those feedback forms are really helpful. And especially if you enjoyed today's training, all of that is helpful for us as a project to continue to offer trainings like this and other topics that you might be interested in. So I want to say a huge thank you to our trainers, Jasper, Gracie, and Tanayo. Thank you for leading us through these conversations and these interactions. I appreciated all the thought and effort that you put into this, and welcome you all to engage with us as a project and continue to keep us on your radar. And you can do that by all the things that you see on your screen right now. You can visit our website. You can join us on Twitter and also our LinkedIn group, which I think we linked before. And you can always email us. Following this training, you'll get an email from us that has the slides. It'll have the feedback form as well if you didn't get a chance to fill it out. And it'll also have contact information for everyone who attended this training that gave us permission to share their email address as well. So you can continue to connect with each other. And these are our lovely trainers. If you want to find them on Twitter or LinkedIn, or email them after the fact and contact them after. They're open to any questions or connections that you all want to make after today's training. I want to thank you all again. Please feel free to unmute yourself to say goodbye. It's been a wonderful 3 hours with you all.
Thank you, everyone.
Bye, everyone.
Thank you.
Bye. Thank you all so much. Take care.
Thank you.
Have a good rest
Thanks
of
for
your
everything.
Thank you for coming.
Thank you all.
Thank you.
Thank you so much.
Thanks, everybody.